We know there are other companies out there that have tried to copy our device by cutting corners in order to sell you mock laser caps. Some of them contain cheap batteries, false lasers, and potentially harmful products. And that is why we understand the importance of US quality and support. We use laser-only technology because there are no clinical trials that prove LEDs on their own are effective in treating hair loss. Each patient represents a unique case. Results may vary from patient to patient. Because Capillus laser caps are designed to stimulate the hair follicle, most immediate biological changes occur within the skin, and they're invisible to the naked eye. The following is a general guideline of what to expect in your hair restoration journey. 0 to 3 months. The first thing you may or may not notice is an increase in shedding. If this is the case, don't worry. Initial hair shedding is actually a sign that the treatment is working. It's indicating that new anagen hairs are pushing out the older hairs to make way for healthy new shafts of hair. Now, some itchiness might be experienced at this point in the process as the erector pili muscles link to the follicle and it contracts. 3 to 6 months. Next, you'll begin to notice a decrease in hair loss. After the first few weeks of using your device according to the instructions, you may notice that your hair is not shedding as much as previously. Don't be discouraged if you don't see significant change. Keep in mind that preventing progression of hair loss is in itself a success. You may notice that your hair is slightly fuller in the areas that you had noticed thinning. At 12 months, now this is the time to evaluate the results of laser therapy. We recommend you take another set of pictures and compare those to the ones you took at the beginning. At 24 months and beyond, this is when you should see the greatest, most impactful results. Expect to see the most you can get from Capillus laser therapy at this point. For as long as you continue to comply with laser therapy, you should maintain a fuller head of hair, and cessation of hair loss should continue. But just as light makes plants grow, it helps hair regrow. Low-level laser therapy is based on the biological effects of photobiomodulation in a living organism, and it's been shown to be effective in stimulating and energizing the cells within the hair follicle. Hair loss in androgenetic alopecia occurs through the process of miniaturization, where hair follicles that were formerly producing healthy hairs begin to produce thinner, shorter, more brittle hairs with weaker shafts until they eventually die and cease to produce hair permanently. Capillus laser therapy reverses the natural process of miniaturization on viable follicles, stimulating and energizing the cells within the hair follicle, renewing the follicle for thicker, healthier hair.